one of the books I read that had a really profound impact and influence on the way I work as a therapist was called The Art of the Obvious by Dr. Bruno Bettelheim. And he was a psychiatrist, an American psychiatrist, one of the kingpins, as it were, a leader in the field. And this book was essentially a transcription of some of the supervision sessions that he conducted and facilitated for a group of psychiatrists, bringing and presenting either patients that they had been working with, were working with, or were going to be working with, so referrals. And I was really amazed and fascinated by the way in which Dr. Bettelheim extracted the relevant information and from maybe the interactions or just from the counter-transference that some of the therapists were presenting and talking about, and present all of this information in a way which was really easy to digest and almost change my perspective on the way I would work or I would see that patient. And I'd say that he was a pure genius at what he did, particularly if I'm using that book as a representation of his work. So I'm going to share with you how I used some of the information I gathered from that book with a particular client that I felt I had reached a wall, hit a wall with. I've just had a brainwave. I'm going to call these videos Therapy 101 to make a distinction in that they are about therapy. They are about clients that you may get stuck with or hit a brick wall with, or maybe you plateau in some way for therapists. Because I believe that, look, as therapists, I think anyone who says they know it all is an idiot. I think that's probably that those kind of statements or that kind of belief system depicts that of these illusionary leaders in the personal development field who present themselves as experts, and you'll see their videos and they'll implicitly suggest that if you follow me, all your life's questions will be answered. I think that's a load of bull, and I don't think you should follow any single person. But anyhow, Therapy 101 is what I'm going to call these videos to make the distinction that these are for therapists working with clients that they may have a block, they may reach a block on. So one particular client I would like to talk about, it was a 27-year-old single white female who, when I first saw, on appearance I believed she was approximately 18 because of the way she dressed. With her communication and the way she expressed herself, I would imagine that she was approximately 15, which indicated to me, although it was my reading of her and perhaps my counter-transference, that would indicate to me, I know myself well and I'm quite well tuned in, that would indicate to me that that is where the developmental block would be around that age. So she'd been referred to me for an alcohol addiction, and this is when I was working specifically in the field of drug and alcohol addiction. And I'd seen her for 3 separate sessions, and I was really struggling with this client because it was almost like a one-way conversation. I was trying to extract information from her. I say extract. I was just trying to have a conversation with her. And it was really difficult. I'd ask her questions and she'd answer questions, but give me what she thought would be the minimal that she could, I don't think she felt like she was hiding anything back, but it was a real struggle. So with I wouldn't say not knowing what to do, with reaching this block, and perhaps part of me not knowing what to do, I thought, let me try something different, because I knew developmentally she's around 15 or maybe slightly younger. How can I get her to go back to that developmental age so that a relationship can be created or she can share what's going on for her? Because what I wanted to discover was what was the thing that caused her addiction or her attention to alcohol, which then led to escapism from reality and therefore an addiction on alcohol. So imagine this scenario. I'm over here, the client's over here. We're at almost like a 45-degree angle. And there's a jar, let's just say this is the jar, of marbles right here. I'll put them here. And it wasn't so much a jar of marbles. It was a jar that was it was held down by marbles because it had marbles in it and had a plant coming out, a little plant pot. So I took the plant pot out on the side. I took one of the big marbles up as I was just talking to her and she was talking to me. So I picked a marble up, big marble, and I threw it maybe 2.5 foot in front of me. So, and I took another marble out, a smaller marble, and I aimed at the bigger marble, and I kind of missed. So I missed, and it went and it hit the door. So, poof. And then I slowly moved this jar towards her, and she picked one up. So I moved the jar towards her, non-verbally indicating it's your go. So she picked a small marble up and went for the big marble and missed, and it hit the door behind. I picked a marble up, threw it at the big marble, missed, and it hit the door behind. And so we went back and forth. And as this was happening, our attention was no longer, the energy was no longer like this. Our attention was on the marbles. Now think about this. Sorry, something's just come up for me, and that's that I remember one of my colleagues, Jennifer, she kind of knocked on the door after a few minutes saying, is everything all right? I can hear some banging. And I said to her, yeah, it's all good. So she left. But think about this. At what age would you play marbles? Would you play marbles as an adult? Unlikely. You might play a game of cards, poker, or something like that. But marbles you'd usually play when you're a kid, a child, a young child, maybe about 7 or 8, maybe slightly older. But what had happened was, as a result of us playing marbles, as we were playing, she started talking. And she didn't start talking in terms of, I'll just share this with you, or I'm okay, or, these one word or, few sentence answers. She really opened up, and she took me with her into her childhood and described how what later emerged was that she had been sexually abused, and that was a big block for her, and her parents didn't believe her at the time. And this is where the root cause of her need to escape began. So I'm not going to go into the rest of it, but what I am going to say is think about what you can use, what you can do, what's available to you in the room and out. You don't have to be I have to be careful with what I say, right? Because everything's about ethics these days. But I have always held my hands up with all clients when I start working with them and say, look, I'm an unorthodox therapist. I'm not your traditional therapist. I do effing blind. I swear. I'll use analogies. I will challenge you when you need to be challenged. I will call your BS when I think it's BS. And it's all in an effort to help you. So I would really get that across. If you choose to work with me, I may be challenging, but I'm going to help. And I'm going to do 100%, and you'll have my undivided attention. So I've slightly gone off topic. What I want to do is go back to that and say, look, what I did was I used marbles in an effort to take this client developmentally back to the age of a child. And that successfully worked. So think about what you can do, how you can use that information that you've learned from me today. It doesn't need to be about marbles, but think about when you meet a client, where are they developmentally? What do they need? What is the reparative relationship going to be about? What's the developmentally needed interventions that you can make that haven't been made? How do you build rapport, right? Is it just when you're working with a client like that and you're trying to be just yourself and you're not getting anything out? You need to try something different, right? So in a nutshell, what happened as a result of that is once she shared all this information, I'm not going to say it fixed everything, but it certainly lightened her load that she was carrying, because she really opened up and shared some information with someone that she hadn't shared before. And not only that, our relationship reached a new level, a new height. Why? Because there was this real connection that was made over marbles. Think about that. Take care.